Hello, good morning, good afternoon, or good evening. Hello, good morning, good afternoon, or good evening, depending on where you are joining us from. My name is Wayne Musabayana. I'm Head of Communication at the African Union Commission, and it is a pleasure to have you join us for the next 1 hour as we discuss the situation of COVID-19 on the African continent. Now, today I'm joined in the studio by Dr. Ahmed Ogwell. He's not a new face to you because he has joined us before, and I'm sure you've seen him in different platforms, still talking about COVID-19, about public health, and about safeguarding the health of the African continent. Now, he's the acting director of the Africa Centers for Disease Control and Prevention. You will recall that last week we said farewell to the director, Dr. John Nkenga Song. So it's really lovely to have Dr. Ahmed with us here today. And in a few seconds, he will be giving you that epidemiological update, as well as other updates on vaccinations and other interventions by the African Union through the Africa CDC. Today, he will also take quite some time to refocus on the messages that came out of the Bureau meeting of the 10th of May, and that was on vaccine manufacturing in Africa. So that is our major highlight for today. Before I hand over the floor to him, let me just give you the contact details for you to send in your questions. The first one is that WhatsApp number +251 94 550 2310. That's +251 94 550 2310. But we'll be happy to talk to you live, as well as to take your questions that will come in through the question and answer section. All right, it's now time for me to hand you over to our panelist and the acting director of the Africa CDC, Dr. Ahmed Ogwell. You have the floor.
Thank you. Thank you very much, Wayne. And good morning, good afternoon, good evening, where you're joining us from. Let me give you first an overview of the COVID-19 situation on the continent as of today, the 19th of May, 2022. Cumulatively, the total number of cases that we have documented on the continent is 11.5 million. And this is about 3% of the total number of cases reported globally. In terms of recoveries, out of the 11.5 million cases that we've documented, 10.8 million have recovered, and this is 94% of all the cases we have reported in Africa. Unfortunately, we have lost 252,000 individuals, and this gives us a case fatality rate of 2.2% and accounts for 4.1% of the deaths globally. In terms of representation of cases, on the continent, we still see that the top 5 countries are South Africa with 34% of the reported cases, Morocco with 10%, Tunisia 9%, Egypt and Libya both at 4%. In terms of the details of the case fatality rate, this week, 36 countries, which is about 65% of our member states in Africa, are reporting a case fatality rate that is higher than the global average of 1.2%. 2 countries, Somalia and Sudan, are reporting case fatality rates that are higher than 5%. 53 countries on the continent, and that is 96% of our countries, have experienced a third wave, while 37% have experienced a more severe third wave. Since the last briefing last week, no additional countries have experienced a third wave. 47 countries on the continent, which is 86% of our member states, have experienced a fourth wave. And 31 of these countries, this is 66%, have experienced a more severe fourth wave. Since the last briefing, no additional member state has experienced a fourth wave. 13 countries, and the list will be provided, 13 countries have experienced a fifth wave, with 7 of those experiencing a more severe fifth wave when compared to the previous waves. Since the last briefing that we had, 1 additional member state, that is Eswatini, has actually experienced a fifth wave. Mauritius has experienced a sixth wave. Now, let me give you a brief on the variants of concern here on the continent. The situation has remained relatively stable from the last briefing, with 49 countries reporting the Alpha variant, 45 countries reporting the Beta variant, 50 countries reporting the Delta variant, 3 countries reporting the Gamma variant, 48 countries reporting the Omicron variant, and all these, we have no additional country that is reporting any of the variants that I have shared there. Now, since November of 2021, 16 member states have reported the Omicron BA2 sublineage which is a variant, of course, a sublineage of concern, not just here in Africa, but also globally. All these details can be able to be provided. The communications team will give you that. Now, let's look at the analysis over the last 1 week. When we look at the week 9th to 15th of May, which is the week 19, and we compare it with the previous week, week 18, the situation is that a total of 59,000 is an 18% increase from week 18. The highest proportion of new cases is from the southern region of the African continent, which has accounted for 91% of these new cases. The other regions have contributed as follows: East Africa, 4%, Central Africa and Northern Africa, 2% each, and Western Africa, 1% of the new cases in this 1 week period. During this week, the following 5 countries have reported the highest numbers of new cases: South Africa, 50,404, Tanzania, 1,482, Namibia, 1,054, Zimbabwe, 910, and Burundi, 870. The following 5 countries are reporting the highest daily incidence per million population. This is, as you know, the average number of new cases for each million population per day. Seychelles, 655, South Africa, 118, Eswatini, 73, Namibia, 57, and Cabo Verde, 12. During this same period, a total of 306 new deaths have been reported on the continent, which is an increase compared to only 201 from the previous week. And this represents a 52% increase in the number of new deaths in Africa. When we look at a 4-week trends analysis, the following are what our analysis is providing. In terms of new cases, we have seen an overall average increase of 36% over the previous 4 epidemiological weeks. And this is in new cases reported in Africa. Regionally, this is the breakdown. The central region has seen an increase of 113%, southern region an increase of 54%, eastern region an increase of 40%, western region an increase of 15%, and northern region a decrease of 12%. South Africa has seen 59% average increase over the last 4 epidemiological weeks. The DR Congo has seen a 39% increase, Kenya 16% increase, Nigeria 16% increase, Ethiopia 1% increase, and Egypt 79% decrease. This is by the most populous countries on the continent. Over the same period of 4 weeks, when we look at the deaths, we see that there has been an overall increase of 33% in new deaths that are reported in Africa. And the breakdown by the most populous countries in Africa is as follows. South Africa, 80% average increase. Egypt, 75% average decrease, while for DR Congo, Ethiopia, Kenya, and Nigeria, there is no change in trends in as far as new deaths as a result of COVID-19 is concerned. When we look at testing and medical supplies, to date, over 106 million COVID-19 tests have been done on the continent since the pandemic started. At the same time, over 483,000 new tests were reported for the epidemiological week 19, that is from 9th to 15th of May 2022. This is a 9% decrease from the previous week, which had over 530,000 tests being reported. The cumulative positivity rate is therefore 11%, and the test per case ratio is 9.2%. For the AP week 19, which is 9th to 15th of May 2022, the positivity rate is 12%, and the test per case ratio is 8%, which is an increase of about 30% in the positivity rate and a decrease of 23% in the test per case ratio compared to the previous week, AP week 18. 5% of our member states, and that is Eswatini, Namibia, and South Africa, are reporting a test positivity rate that is higher than 12% for this week 19. Apart from COVID, seen the report of a new outbreak of wild polio in Mozambique. A few weeks back, we had it in Malawi, and yesterday, the health ministry in Mozambique announced one new case of wild polio, and when sequenced, that particular case had very close similarities to the case that had been reported in Malawi some weeks back. Also, I would like to share that on May 5th, 2022, as Africa CDC, we did announce the second annual International Conference for Public Health in Africa. And this will take place on 13th to 15th December 2022 in person in Kigali in Rwanda. And this is the second edition of the conference and is expected to help further Africa CDC's mission of safeguarding Africa's health. And we look forward really to many African and our friends from outside of Africa coming together during this week in Kigali in Rwanda to attend this conference on public health in Africa. And as Wayne had said, at the end, we will look a little bit in detail at the message from the Bureau of the Assembly, which took place on May 10th. But let me highlight two things out of that. One is that our heads of state have expressed great concern at the low purchase of vaccines from African manufacturers. And here we are talking specifically about COVID-19 vaccines. They have also expressed concerns at the low rate of vaccination on the continent. Everything is being done to make sure that we improve these two aspects of increasing vaccination and also increasing the uptake of vaccines that have been manufactured here on the continent. So these will be able to go into a little bit of detail at the end so that it forms part of the message for today. Thank you.
Thank you very much, Ahmed. That was Dr. Ahmed Ogwell, who is the acting director of the Africa Centers for Disease Control and Prevention. We are now into our question and answer section. And today we are still using that WhatsApp number +251 9455 to the question and answer section, as well as the live discussions that we can have right here. So we have a question that has come in from Janice Q, who is with Bloomberg. And Janice says, I have 3 questions, please. So let me give you the first one. How will the African Union get Gavi and or COVAX to implement the communique and place orders? The second question, does the Africa CDC have any sense of the Omicron BA4 and BA5 sublineages and what is driving these increases? And are there any countries that you see where the current waves are peaking? So those are the first 2. I'll come back to you with the last one a bit later.
No, thank you, Janice. And in general, the African market is quite large, and our heads of state have taken cognizance of that. How to get all partners and other institutions that are purchasing vaccines to actually order from our African manufacturers is going to require open conversation, a frank conversation with not just here on the continent ourselves as Africa, whether it is leaders or manufacturers, but also very frank discussions with all those entities who are purchasing vaccines for Africa, whether it is philanthropies, it is intergovernmental organizations, or whether it is African governments themselves. We'll have very frank conversations over the next days, and we expect that the message that has come from our heads of state is going to be respected, and we will work on a good way of implementing it in a manner that is going to be beneficial to Africa. And when that begins, we shall be back here to communicate to you the results of that. We are not in the business of forcing, but we are in the business of securing Africa's interests through good, open dialogue. In as far as the BA4 and 5 sub-lineages are concerned, we are currently expanding the sequencing of samples from all countries on the continent so that we can have a better sense of where the focus of these 2 sublineages is. I will be a little patient so that next week we will give you a much better picture, because samples are currently being analyzed. We'll be able to have much more specific information during next week, because it takes a bit of time to get all the samples analyzed in the relevant labs across the continent. So let's park that for next week.
All right, thank you, Ahmed. The third question that came from Janice is about Ebola. And she says the Ebola fatalities in the Congo are raising concern of a more virulent strain. Does the Africa CDC share this concern?
No, thank you, Janice. Indeed, the initial data that we are getting is suggesting that we are seeing fatalities that are a little higher than we have seen before. And this for sure is raising concerns. What we would like to be sure about is that the case fatality rate is what is being reported. So there's a lot of data being collected from the communities that are affected. And we want to work closely with the government of the DRC so that we can be able to provide a clearer answer on whether this is a more virulent strain, as it were, or the data is the one that just needs to be properly analyzed. So we are still out looking for good data coming out of the DRC, analyzing it properly, and in close consultation with the government of DRC, we'll be able to provide good feedback when the picture has become a lot clearer. We are not at the moment convinced that the current outbreak is worse in terms of case fatality rate than before, but we are looking to that data very, very closely, and we'll give you that feedback as soon as we have convincing information.
All right, thank you. We move over to Kenya now and say hello to Judith Akolo, who is with the Kenya Broadcasting Corporation. Firstly, she says, welcome, Dr. Ogwell. And she says, my question is, Kenya neighbors South Sudan and Somalia. Is there any danger of the increase in fatalities due to the COVID-19 in those two countries having an impact on Kenya? She adds that I ask this because I think the increase in fatalities is also due to an increase in infections and the low vaccination in the two countries.
Thank you, Judith. A case of COVID anywhere is a risk everywhere, and not just to the immediate neighbors. It is a risk to the whole world, because communication is very, very easy these days. People move around relatively easily, and when we have that combined with more relaxed sort of protocols, the COVID-19 protocols, it means that anywhere where cases are increasing becomes an immediate risk for all other countries across the globe. The situation in both South Sudan and Somalia is such that we need to intervene to ensure that it does not replicate itself elsewhere, whether it is the neighbors or those that are further away. But we cannot link the increased fatality rate in both countries to any specific situation in Kenya or any of the neighboring countries. We treat all increased cases anywhere and all increased fatalities anywhere as the same, and we support these countries to be able to identify where the hotspots are, where the weaknesses in the health system are, so that we can not only be able to reduce the death rates, but we can also be able to reduce the caseload as well. At the moment, we are not seeing any of the neighbors of South Sudan or Somalia having similar trends. And so we are treating this as within each and every country of these two countries, and we are helping them to contain the current increase in numbers, both for cases and for fatality rate.
Thank you, Ahmed. Sarah Jerving, who is with DevEx, follows up on a briefing that a statement that formed part of your briefing earlier on. And she says, how concerned are you about the new polio case? What could this mean about the extent of the spread?
Thank you, Sarah. It's a big concern because this is wild polio. It is not vaccine-derived polio. And being wild polio, it means it was introduced into that community from somewhere else. And just like in the case with Malawi several weeks back, that becomes a trend, because if you see neighboring countries starting to show these signs of wild polio, then it means that there is a leakage of in the surveillance system where concerned. We have been providing support to Malawi, and the situation there is under control. And we are about to send off a team to Mozambique to support that country as well, so that we can contain this particular outbreak within as short a time as is possible. Any case of wild polio is a public health emergency of international concern, and so we treat it with all the seriousness that it deserves.
Thank you. It's time for us to say hello to Paul Adeboju, and Paul is joining us live. Paul, good morning. Please go ahead with your question.
Yeah, good morning, and yeah, thanks for taking my question. So the on 31st of May is World No Tobacco Day, and tobacco has really been a major risk factor for some individuals regarding the outcomes that if they are done with COVID. And if we go back to during the lockdown period, I read a paper in South Africa that showed that the lockdown, even though it was associated with many disadvantages, was actually instrumental in encouraging some individuals to actually quit smoking. Going forward and considering these issues, connection with many non-communicable diseases, and now we are still seeing its action on COVID-19. I searched the Africa CDC's website, but I did not really see anything much regarding highlighting or recommending or any issues regarding smoking or tobacco control. So I'd like to know how can Africa consolidate the attention that COVID has brought to some lifestyles like smoking, and towards ensuring that its people live better lifestyles, and prevention, which is ensuring that somebody is at minimal risk, is also incorporated into the continent's public health arsenal. Thank you.
No, thanks, Paul. And indeed, good evidence has shown that during the lockdown, due to the restrictions, there were lifestyles that changed for the betterment of people's health. Smoking is one of them, because access not only became difficult, but also smoking indoors being banned encouraged many to quit that particular habit. In as far as this link between COVID and NCDs is concerned, the non-communicable diseases, we are working on some paper, a white paper to be to provide information how NCDs and COVID-19 have interacted, particularly during the peak of the pandemic. And we are also starting with our division of disease control and prevention. We are starting to address issues of non-communicable diseases, injuries, and mental health more systematically. And that is why you are not finding much in terms of write-ups on our website. Before the end of this year, there will be a lot more for you to get from the website there. So in as far as consolidating gains, particularly around lifestyle, we as Africa CDC have two plans in place. One is all the lessons that we have learned during this pandemic. We are picking out the ones that are easy to sustain for public health and for health in general. And we are going to engage our member states to keep those in check, whether there were protocols that were temporary or not, whether there were a situation that resulted in lifestyle changes like what you have explained. We are right now unpacking those lessons so that we can be able to give some guidance to our member states for how they can be able to consolidate those gains and ensure that public health benefits. And the second is when we are designing our preparedness, we are using the lessons. So it is very clear now, looking at non-communicable diseases, it is very clear that when you do good preparedness and response to any public health emergency, there are benefits to non-communicable diseases, just as there are some risks that come along with that. For example, lack of exercise and things like so. As we are designing our preparedness into the future, we are putting those in place so that it becomes a program that will cover not just the public health emergency, but will also cover the other areas of health that may be affected, whether positively or negatively, reinforcing the positive and preparing for the negative. So this is work in progress, Paul, and you'll be able to see a lot more as the year evolves and we put in place the necessary programs to address these lessons.
Thank you, Ahmed. Let's say hello to Ralph Kruger, who is the correspondent of German press agency, the DPA in Johannesburg. So Ralph says, a lot of people are concerned about the current outbreak of monkeypox. Has there ever been a similar outbreak in Africa, and how dangerous is it? And then, do you have any idea if have had an impact?
Thanks, Ralph. Let me answer the second question first. We do not have clear data right now to suggest that there is a link between the current outbreaks in several parts of the world of monkeypox with the COVID-19 pandemic. But suffices to say that both pathogens, the COVID-1 and the monkeypox ones, they come from the animal kingdom into the human side of life. And this, although does not suggest a link, but it shows you that the possibility of one affecting the other is certainly something that needs to be investigated more closely. Has there ever been monkeypox in Africa? Yes. And unfortunately, this is one of those outbreaks that during the COVID-19 pandemic, in fact, we've had at least 2 outbreaks of monkeypox on the continent. And they were all under the radar, and we handled them and contained them. But now that it appears elsewhere in the world, it becomes big news. Is it dangerous? All infections are by and large dangerous, depending on how the body reacts to that particular pathogen. And so it is important that where the outbreaks are, good investigation is done so that a source is found, and therefore it can be contained quickly before it spreads a lot more. In Africa, it has largely been with communities that live on the fringes of the forests, and these have been relatively quickly contained, and that is why probably it never made the news. We hope that it does not spread much more than it has now across the other parts of the world, and our expertise, our knowledge, and lessons we've learned in controlling monkeypox, we are available to support those who may require that kind of support.
Thank you, Ahmed. I don't know, before we move on to the next question, could you just briefly outline what monkeypox is?
So monkeypox manifests in the human being as sores on the skins. And the sores expand in size and sometimes can actually be able to, if not well taken care of, they can be able to transform into a wound. And this infection has the potential of breaking down the weakness, breaking down the immunity and making the immunity weaker. And therefore, infection becomes very easy in someone who has been infected with monkeypox. But the good thing is that it manifests quickly and therefore can be able to be identified and treated, contained before it spreads. But then in situations where people live closely and the hygiene is not very high, then it becomes easy to be able to spread from one person to the other.
Thank you very much. I hope some of the colleagues benefited from that explanation. Let's move on now and say hello to James Macharia Chege, who is with Reuters in Johannesburg. He says, I have a follow-up question on polio. Health authorities in Mozambique declared an outbreak of wild polio virus on Wednesday after confirming that a child in the country's northeastern Tete province had contracted the disease. Why we are seeing this second outbreak? Why are we seeing this second outbreak in Southern Africa after so many years without any new cases? And is it to do with a decline in routine child immunization rates due to the COVID-19 pandemic? And also, what steps are being taken to contain it? I think you've touched on some of those issues before, but you might have extra comments.
Yes, I think the steps being taken are clear. Those I've shared. The governments, both in Malawi and now in Mozambique, are doing large-scale immunization around the areas where the cases were identified, and surveillance has increased, and retraining of the health workers in those regions is also happening, so that their index of suspicion goes up, and you don't have to wait until someone comes down with the flaccid paralysis. So steps are in place. Immunization, for sure. The decrease in immunization exposes us, all of us, particularly those who are at risk, to much higher risk of getting this polio virus manifesting clinically. Those who have been immunized for polio are much, much less at risk than those who have not been immunized. And that is why one of the key interventions that is happening on the ground is immunizing the children's population in the areas that are affected. Why is it coming? And this is the second case after a very long time. That's very difficult to provide an answer to. But there are things that give pointers. One is the relation between the first case in Malawi with travelers who had come from outside of the continent, because this particular strain had also been reported in some countries in Asia before. And so ease of travel and lower index of suspicion and lower surveillance for polio will then allow it to manifest in the community. Second is immunization, of course, has been affected during the COVID pandemic. And other things have also come into play. Food has not been as easy to get. So the way that the children can be able to fight any pathogen that gets into their system is affected in a situation where the immunity is reduced by other factors like nutrition. And also remember that now, during this COVID-19 pandemic, one good thing that has happened is our surveillance systems have become better, not just for COVID, but also for all other diseases. Any new type of illness that is seen, the reporting system has improved. And so picking out some of these things before someone were to pass away as a result of a particular pathogen are much less. We pick them up faster, and therefore that could have contributed. But to give you a clean answer why the second outbreak in neighboring countries after a very long time of absence in Southern Africa, that is something that our disease surveillance colleagues will be able to answer in the coming weeks. All
right, thank you. Let's go to Edith Mutetia Edith, we would be grateful if you can just indicate to us which news agency you are reporting for. But Edith asks the question, what is your take on the fact, as stated by WHO Africa, that the majority of Africa's healthcare workers are not vaccinated against COVID-19?
No, thanks, Edith. The realities of Africa are there to see. We only have about 17% vaccination rate. I mean, those who are fully vaccinated on the continent, and that is a huge minority by any standard. And that will affect literally all sectors of society. What we need to do, however, is to ramp up the vaccination on the continent so that at the very least, we are able to reach the 70% that we have talked about. And at the very most, we can be able to get even more people boosted for those who qualify for the booster shot. But at the very least, we need to get to 70%, and our healthcare workers are not different from the population. If the total is 17%, you would expect that healthcare workers, the numbers will not be that much more than that particular figure. We are far. We need to do more so that we can be able to get as close as possible to the 70% target that we had from last year.
All right, James Chege comes back and he's with Reuters in Johannesburg, and he's on the subject of monkeypox. So he says, you are aware that the UK, the USA, Canada, Spain, and Portugal are seeing outbreaks of monkeypox, which originated in the DRC and is relatively common in Central and West Africa. So the question is there an uptick of or a resurgence of cases in Central and West Africa? I know you've already spoken about incidences elsewhere on the continent.
Mm-hmm. Yeah, indeed, James. You may have missed my earlier response that during this pandemic, we have had several outbreaks of monkeypox on the continent, particularly in the central part of Africa, that belt. So it is not new to Africa. We also expect that another outbreak will come, and we'll handle it in the usual way. We are, however, concerned at the multiple countries outside, especially in Europe, that are seeing these outbreaks of monkeypox to be very useful for knowledge to be shared regarding what the source of these outbreaks actually are. We are in close contact with our counterparts at the European CDC to try and understand where that did come from. Because when you see monkeypox in environments that are far away from a forested area, then for sure, in as far as public health is concerned, it raises a lot of questions that will need to be answered, and we'll continue to engage with them to understand where those outbreaks are. In Africa, multiple outbreaks, we have been containing them throughout the pandemic. So we have very good experience with containing outbreaks of monkeypox here on the continent.
Okay, thank you very much. We don't have any more questions that I can see on all our three platforms, which is the WhatsApp group, the live question, the live discussions, as well as the question and answer section. But in fact, I've just received another one, and this one is coming from Bonisile Makubu from the Times of Eswatini. And she says, do we have African countries that have not progressed to newer waves of COVID-19? For example, countries that have not experienced maybe the second or third waves as yet?
No, thank you, Bonisile. The COVID pandemic is very dynamic. And that is why on a weekly basis, we let you know if there are any new outbreaks that have come in the previous epidemiological week. So on a weekly basis, we monitor, and indeed the majority of countries have not had new waves. But looking at the countries that have had new waves over the last 2 epidemiological weeks, it tells us that we are slowly seeing the bottom of the valley turning into another hill, which means, as usual, in between each wave, we usually have two months or thereabout of low numbers, and then it starts to rise. And it means we need to use those 2 months or thereabout to prepare, so that when the next wave, when the next round of infections come, we can be able to control them relatively fast. But the majority of the countries are not undergoing any wave at the moment, and it is exactly the time for us to vaccinate, and the time for us to increase our surveillance, the time for us to ensure that we are testing adequately, so that if any new cases are coming up and any new wave is coming up, we can be able to identify it quickly and respond also quickly and contain that spread of any new wave. But the majority of the countries on the continent are not undergoing any new wave at the moment.
Thank you, Ahmed. We have Rhoda Adiambo, who is with the British Broadcasting Corporation, and she is asking for further clarity on the monkeypox outbreak. So she says, which countries are these that have had outbreaks in Africa? And also, can you just state if this happened this year or last year?
Thank you, Rhoda. I'll provide you with a more comprehensive list. But what I can be able to remember now, DRC has had, Central African Republic, Cameroon, Nigeria. I remember these 4, and I know there are more, and we'll be able to provide you a longer list. This has happened during the pandemic from 2020, 2021, 2022 as well. There was an outbreak in Cameroon that we were dealing with. So throughout the pandemic, from 2020 to date, there have been different outbreaks of monkeypox in Africa.
Thank you very much, Ahmed. I just want to acknowledge that our colleague Edith has come through, and she's stating that she's with China Daily. So Edith, thank you very much for that. I believe that we have asked all the questions that we have, and it is time for us now to go into your summary or a roundup of the really key points that you want colleagues to take away from today's briefing. So please go ahead.
Thank you, Wayne. And so in terms of the key takeaways for today, I think the first is outbreaks will occur anywhere, as we've seen with monkeypox and as we are seeing with the wild polio in Southern Africa. It will occur anywhere, and when it does, then all the public health assets that are required to do good diagnosis, to identify the hotspots, and to respond and contain any outbreak are required to be mobilized. And we are doing that as Africa CDC with our member states here on the continent. This is one. Second is that we are slowly seeing an increase in cases of COVID-19 here on the continent over the last 4 weeks or so. And more and more countries are reporting this increases in the number of cases. This is a clear sign that there is a possibility that there is a new variant or a new sublineage or variant that is more transmissible, and therefore providing us with a picture of increased numbers. We need to do more testing so that we can be able to understand where the outbreaks are, and we need to continue doing more sequencing so that we can be able to identify what variants or sub-lineages are these that are causing this increase in numbers. Third is we are seeing distinctly that where the numbers are increasing, deaths are also increasing. So the comfort that some variants are not as lethal is only useful to the one who has not died, but the one who it affects and dies, it's not comfort at all. So prevention will always be much, much better than taking a chance. So the number of deaths are increasing, and that is not very good news on a continent where vaccination rates are very low. Finally, is the way that we need to address the low vaccination rate lies in two parts of one coin. One is vaccination rollout to be increased, and we hopefully will discuss this in a little bit of detail in next week or the week after to share our plans for vaccination rollout increase on the continent. And as you do that, you must have access, and access has to be sustainable. And this is where manufacturing on the continent of Africa becomes very important. And I will end, therefore, with the message from our heads of state from May 10th, when the Bureau of the Africa Union Assembly met. 8 heads of states were represented, and 12 countries participated during that meeting. And you have seen the communique, but I will emphasize that our heads of state have called for increased vaccination on the continent. Our heads of states have called for all those who are actually purchasing vaccines for Africa, whether it is our African governments, whether it is philanthropies, whether it is intergovernmental organizations like Gavi and COVAX and UNICEF. All of them have been called upon to purchase vaccines that are manufactured here on the continent first, and then if there are gaps, they can be able to fill that with sourcing from elsewhere outside of the continent. It's the only way to be able to keep the vaccines manufacturing enterprise on the continent alive. If we don't do that, the next pandemic, we will not have any local production of anything. And that is a major risk. And that is why our heads of state have made it very, very clear. As Africa CDC, we intend to implement the decisions of this meeting of our heads of state by putting in place the working group, by facilitating vaccines manufacturers with technical assistance, and also by engaging with all these organizations that are purchasing vaccines to ensure that they respond to that call by our heads of states as they did on May 10th. And this is my message for today. Wayne, I thank you very much.
Thank you, Ahmed. That was Dr. Ahmed Ogwell, who is the acting director of the Africa Centers for Disease Control and Prevention, the Africa CDC. Today, we've really covered a wide range of public health issues, not just COVID-19, but there were also questions around Ebola, questions around polio and monkeypox. And I think that this really shows the need for us as the continent to keep staying ahead of the challenges. So that is our briefing for today, colleagues. Thank you very much for having joined us. And I want to thank colleagues behind the scenes from the African Union and from the Africa CDC, as well as Dr. Ahmed Ogwell, who was speaking to us today and answering your questions on the various issues of public health on the continent. We will meet again next week on Thursday at the same time. For now, bye-bye.